Western Cape Adjustments Appropriation Bill.
Okay, thank you. I recognize the Minister, Mbombo.
Acting Mama Somlomo, Honorable Premier, members of the Executive, members of the House, I rise here tabling the final budget adjustments for the Department of Health. In the beginning, 2016-17 financial year, we started with a budget of 19.982 billion. The adjusted appropriation is 20.144 billion, which presents us with an increase of 161.752 million. Due to the tough economic times we find ourselves in, it has been crucial that certain adjustments be made to the various programs for optimum use of the resources that we have, and also to prioritize, because we must show that we are a responsive government. And despite the turbulent economic times, the department has adopted stringent financial approaches in order to cushion the blow on the actual services. So that's why we have done everything in our power to shield those we serve. For example, we have ensured that we save from our revenue almost about 52 million rand over the 2015-16 financial year. While tough decisions needed to be made for this to be possible, it has been the buffer that we need to keep our services going. In addition to that, we have bagged a multi-million rand from the Global Fund to assist with the fight against TB, HIV among women and girls. And we are the only 2 provinces in this country to be awarded with this grant, so that we can pilot it using innovative project skills. That's why today I want to dedicate it, because today is the World AIDS Day, I want to dedicate it for us, taking the whole issue of the HIV prevention in our hands. As it has been alluded previously, that we might be the country that has got the largest ARV program in the whole world, yet with the new infections, especially the young girls. Members, in case probably you're not aware, every week 2,000 young women between age 15 and 24 get infected. And if you count it for 2016, we have had new infections of about 270,000. And it's 5 times greater than infections of any country where women are infected.
What awareness program are you doing? You can't just be getting problems.
Now, in terms of the innovative program for young women and girls, the implementation has already commenced in April 2016 and was officially launched in October 2016 and will be rolled out as part of the pilot in the Mitchells Plain and the Klipfontein area, which includes the Gugulethu, Crossroads, Philippine, Nyanga, Hanover Park, Manenberg, etc. It is an ambitious program targeting specifically for this one, age 19 and 24 years, in addition to the existing programs that we have. The key population is the focus for this year, because we cannot do everything for everybody. Because we are seeing that girls are engaged in sexual relations with men with an age difference of about 8 years. It will deliver a package of care based on an evidence-based approach that goes beyond the health sector by addressing the drivers that increase young women's risk to HIV, including poverty, gender inequality, and poor education. And this initiative will provide a basket of services, including self-empowerment, coaching, parenting, and caregiver programs, and a combination of socio-economic incentives aimed at HIV prevention approaches. Now, if in terms of looking at the breakdown of the adjustment, this budget, out of that 161 million, almost half of it is dedicated to the HIV/AIDS. From that, 48 million, it's based on our savings from the previous financial year, where we have to put more money on the ARVs, because the grant for the ARVs has decreased. Hence, we give that to the City of Cape Town, which also offers these kind of services. 4.5 million is retained from the money we have had the allocation through the Global Fund from the 15-16-18. 24 million, which is the one that we have just received now, as part of the 270 million for the 1st of April 2016 to March 2019 has been allocated for the Women of Wealth project, as I mentioned earlier. Now, if you look at terms of the shifts, we've got a shift from the vote tree to us, from the Provincial Treasurer vote tree to fund contract posts in the department for effective management of the supply chain program, where we use the program Logis. And then we have a shift that goes to vote 1 to the Department of the Premier to fund the ICT requirements for the infrastructure for various clinics and hospitals. Because if we truly really want to move towards a health system that it can be conducive and responsive to everything, it means that we have to keep on updating our ICT. Health information system is part of the building blocks to strengthen the whole of the health system. In terms of the adjustments, in terms of the rollouts, because we work closely, it needs the whole of society for health. We work closely with the NPOs, hence the 3.2 million from the 2015-16 comprehensive care for the vaccines and tuberculosis that was meant for the NPOs is being rolled over, so that because for them they always submit their claims very late. And then for the program 6, for the training of the health sciences, again, for the training of community health workers, we rely on the NPOs for that training. Hence, for the community-based services, we are asking for the 2.5 that was meant for the EPWPs for all those community-based services that are offered by the NPOs. In terms of the infrastructure, 59 coming from the 2015-16 as part of the health facility revitalization grant that is awarded by the national. We are asking for the rollover because, as I always say, that when it comes to health infrastructure, the building might be completed, but if you don't receive the machinery on time or the equipment on time, which is you get it from overseas, it means you have to shift to another, which is, for example, in this case, the health technology. In terms of the National Health Insurance Grant, we received 4.7 million to strengthen again the information system. I must just mention that, Madam Speaker, that for this one, it's from the direct to the indirect grant, and we are the only province that has been tasked to provide what we call disease-related grouping reimbursement model in terms of the disease renaming. So this money is meant for that. And I just also want to indicate that, again, that for all of this 161 million, again, that half of it goes to the HIV and AIDS. And I want just to thank now everybody, especially the HOD, and congratulate her because it's her first budget, and it's my first budget. Also with the staff, that collectively was a collective work, and I want also to thank the Community Development Committee who spent hours poring over each figure on each page to ensure that their constitutional mandate is met. We appreciate the passion which the committee has put in terms of this budget, and also to hold us account and ensure that our obligations are met. I hereby table the budget. Thank you.
Thank you, Minister. I see the Honourable Member Botha.
Thank you, Speaker. Strategic Goal 3 commits the Western Cape Government to increasing wellness and tackling social issues. The Department of Health, under the watchful eye of Dr. Noma French Mbombo, is tasked with providing quality health care to the citizens of the Western Cape, whose overwhelming majority are without medical insurance of any kind. The department remains committed to promoting healthy and inclusive communities that take, as Minister Meyer put it, ownership of the personal safety and wellness. Speaker, the adjustment appropriation reflects a 161,752,000 rand increase from the main appropriation. These are welcome resources that I am pleased that this will be used in ensuring the people of this province have access to improved quality health care. I cannot state enough the importance of the first 1,000 days initiative. The first 1,000 days of a child's life are critical in the development, and this program is aimed at raising awareness of this crucial stage. The department identified 3 pillars which are critical in ensuring the healthy development of children. They are ensuring the health and nutrition of both mother and baby, providing mothers and babies with support from fathers, families, and the whole community, providing the right stimulation for the baby's learning needs, and giving them a safe substance abuse-free environment which promotes well-being. This is one of the priority projects of the department, and we will continue to monitor the success of the program as it ensures the safety of both mother and newborn child. Another priority program for the department is the HIV and TB outcomes. As the Minister have just alluded to, it's the 90-90-90 strategy. And the targets for the programs are by 2020, 90% of people living with HIV will know their status. By 2020, 90% of people which have been diagnosed with HIV infection will receive sustained antiretroviral treatment. And by 2020, 90% of all people receiving antiretroviral therapy will have viral suppression. The department is making positive strides towards achieving this strategy. Speaker, the Western Cape on Wellness campaign, better known as WOW, partners with the provincial departments and NGOs and other stakeholders to promote healthy lifestyles by promoting better eating habits and increased physical activity. I mentioned this program, Speaker, because a few weeks ago I stood here and urged members of this House to get screened because studies reveal that globally 1 in 2 of the 415 million people living with diabetes are not aware that they have the disease. Today, I want to again urge you to make use of our healthcare facilities and get screened. I care even for the parties, for all the parties in this House. Speaker, in conclusion, let me once again thank the department for its continued commitment and dedication to making quality healthcare available for all our communities in the Western Cape. It is through their efforts that we see, amongst others, the following successes. Infant mortality rates declined by 15% between 2008 and 2011. Under 5 mortality rates have declined by 7% in 2013. Maternal mortality rates have decreased dramatically since 2008, and this can be attributed to the success roll out of the PMTC programs. I just want to thank the important role that the dedicated staff of the Department of Health continue to fulfill in ensuring that we have a healthy and well-informed society. The pressure and environment they work in can be quite unfavorable at times, but day in, day out, they go out with one task at hand: deliver service to all in the Western Cape. Speaker, the DA supports the appropriation for vote 6. I thank you.
Thank you. I recognize the Honourable Gopi.
Speaker, let me take this opportunity and say that last night, as I attended a memorial service of the late Air Commander Fidel Castro, the revolutionary president of Cuba,
Order.
I learned that
Order.
Cuba has opened the doors to train student doctors from South Africa.
So, members, there's a speaker on the floor. Thank you.
I learned that Cuba has opened the doors
So,
to train
Honourable Gopi,
students.
would you take your seat, please? There's a point of order. Chief of
Is
Parliament.
the honourable member prepared to take a question?
I will ensure that I ask Honourable Gopi, are you prepared to take a question?
Not now.
No, the member is not prepared to take a question.
Speaker, I learned that Cuba has opened the doors
Order, please,
to train
members.
students from South Africa. However, it was a sad moment for me when Deputy President Cyril Ramaphosa told the audience that it is only the government of the Western Cape that refused to be part of this program. I was disappointed, and I then wondered whether this government is serious in improving the poor health care in this province. It is common knowledge that our healthcare centers and institutions are short of medical practitioners. Yet this government does not want to take this golden opportunity offered to us by Cuban government. Recently we heard a shocking news that a practitioner doctor who was working with
Order,
expired...
please, members. Sorry, Honourable Gobi, your members behind you are detracting. If I could ask Honourable Lecker, you have a speaker on the floor, as well as the members on this side. Thank you. You may proceed, Honourable
Recently,
Gobi.
we had the shocking news that a practitioner doctor who was working with an expired license and who was employed through an agency raped a patient in Nyanga Clinic. Upon his arrest, more evidence came to the fore that there were other similar cases in Mitchell's Plain Hospital. The ironic of it all, this department pleaded ignorance instead of taking responsibility. The Department of Health is confronted by many challenges of service delivery, from overcrowded clinics to fewer beds to accommodate patients in the hospital. In the hospital like Easter River, has become a norm for patients to sleep on the chairs for up to 4 days whilst being treated. On the other hand, diseases like diabetic are on the rise in this province. It is reported that in colored communities, it is worsening, with 1 in 4 adults are likely to be affected. Elsewhere in Beaufort West Hospital, allegations of racism and inefficiency have emerged, with patients claiming senior medical positions are reserved for whites, regardless of the competence of black staff. We can ill afford non-use of budget public funds. This department is the culprit in this regard. Why the revamping of Tygerberg Hospital is put on hold, whereas the rollover are the order of the day. Instead of committing to improve service for the poor, this department can still afford rollovers more than 74 million. Looking closely at some of the reasons given for the rollovers are lame excuses of claims for City of Cape Town not being submitted timelessly, resulting in accruals. EPWP delays in filling of training posts resulted also in accruals, due to delays in appointment of professional services and slow progression on scheduled maintenance projects, slow progress on sites, poor contractors' performance, delays with procurement and outstanding final accounts. Clearly, all these reasons are mere incompetency and gross negligence on the part of the senior management and extensive authority. While there is a change of heart in replacing GF Jewester Hospital, these adjusted estimates should have adequately created for this hospital. The reason for these rollovers are not acceptable and must be condemned in the strongest term. The shift of funds, 1 million rand from Program 8, Health Facility Management, to the Department of the Premier is not supposed is not supported because this very same
Order.
This very same program has rollovers of 62 million rand. Service delivery will suffer severely because the state of our health facility is in the worsening. And nogal, we are doing this on the World AIDS Day, this budget today. Thank you.
Thank you, Member Gopi. I see the Honourable Christians. Honourable
Speaker.
Yankee. Maintain
Speaker,
your composure, please.
Speaker, typical ANC. What are they for? What are they for? Because, Speaker, Member Gopi say 2.5 million rollover
Order,
for the
please.
EPW program. But she's not saying that it goes
Order,
for
please,
training.
members.
It goes for training for community-based NGOs. Do they know what these people are doing to the poor of the poor, treating them, being there for them, especially the elderly? But all that they do is complain. Complain. And Speaker, I want to just conclude because my minute is up. We support this budget and we thank the Minister and the Department for the work done in the poor communities. I thank you.
Thank you. Could we get some order, please, members? I see the Honourable the Minister, Minister Mbombo.
Thank you for the inputs. Thank you from my chair for the inputs, Honorable Christians for the inputs, and also from Honorable Gopi for the inputs. I don't want to stand here and lecture people because in most of what has been said now, these are the things.
Order, please.
These are the things that are already in the fore. I'm not sure whether probably, even including the Deputy President, has seen the evaluation by the provinces that have sent students to Cuba. Up to the level, actually, that now they say it's no more. So they are no longer doing it because of the reasons.
Order, please.
Because of the reasons, because the report shows that
Order,
not
please.
only it's expensive, but when they come back, because they are only exposed to primary health care, their level of the skills are not. I've got a limitation.
Order, please, members. Allow the Minister to speak. Honourable Magaka. Members, this is not a debate across the floor now. The Minister is responding to inputs. If we could afford her the opportunity to complete a presentation, you may proceed,
Okay.
Minister.
The quadruple burden of disease
Sorry,
in
Minister,
South
could you
Africa.
take your seat, please? Is it a point of order, Honourable Werter?
Yes, Speaker, I just want to know, is it parliamentary for a member to say, moenie kom lieg nie, moenie hier kom lieg nie?
I can't say that I've heard that. If you're willing to say which member it
It's
is.
member Lekker.
Okay. Honourable Member Lekker, may I address you? A point of order has been raised around a statement that was made. If you could stand up, please. Sorry, Minister Mayor, I saw that. That's inappropriate, and the member is standing. Minister Mayor, I can't ask you to withdraw your slap, but it is inappropriate. Thank you. Sorry? It's your own members who made the noise, that's why. Yeah, but the member, Minister Mayor.
I apologize.
Okay. Now, Honourable Member, if I could address you, a statement was made about, and you would know what the statement was. Did you indeed make that statement? A statement was made Moenie hier kom lieg nie. Did you indeed make the statement? Because, would you withdraw the statement, please? Thank you, Member Lekker. You may take your seat. You may proceed, Honourable Mbombo. Thank you. Order, please.
Okay, thank you, Speaker. As I was saying that the quadruple burden of disease in South Africa, it starts with interpersonal violence and injuries. If you count how many injuries and violence that is happening in Cuba versus South Africa, the second part of it is the issue of the maternal and child health. If you look at how many deliveries that are happening in Cuba and also the complicated deliveries versus South Africa. The third part is HIV/AIDS and also other communicable disease. If you count how many TBs, what is the prevalence of HIV in Cuba versus South Africa? So I can count all of those. So the evaluation that has been performed by the provinces that are sending students to Cuba, they found that there's still, whilst it's a noble intervention, but there's a limitation in the response in terms of what is happening in the context of South Africa. Number two, money-wise, the money, it comes from the provinces and then goes to Cuba. And then the comparison of how much you spend on sending a student to Cuba versus we have got about 8 medical schools in South Africa. And those schools, they are known everywhere in the world of producing the best. What the country needs to do is about to invest in the resources so that they increase their numbers. And then number 3,
Order, please.
Primary health care is the South African approach. It has always been the approach. So it's not about that students has to go outside to learn primary health care. Actually, South Africa is the trendsetter when it comes to PHC, even before the 1987, when it was declared a part of the primary of the Alma Art Charter. If you look at it, so actually when we say decolonize health sciences, it means that bring it back to what we already have. We don't have to go outside. And probably Western Cape, for not sending students to Cuba, we have already decolonized because they don't have to learn Marxism. So we are here. So, yes, exactly. Now the second part of it, there is no
Order,
way.
please. Honourable Chatja. Members, the minister is responding. I think the ideological debate can take place at lunchtime. You may proceed, Minister. Honourable Magaka.
For any
Order,
complaints,
please, Honourable Mugaka.
For any complaints, the ill treatment of patients, there's nothing that one can justify. And if it happens, it's everybody's responsibility if that person pick up that ill treatment of the patients, or even the issues of, for example, like the issue that has been mentioned about the rapes. So that's why any ill treatment will respond to that. So that's why in every facility, you'll get a hotline number, a please call number, an 086 number, and all of those. So we cannot make any justification about, because as I always say that health is a human right as well. The ICT Health Information System, as I indicated, is part of the building blocks on strengthening the health systems. So in order for the clinic to communicate to the hospital, you need an information system, because it's no longer where people carry the folders. In order for a Beaufort hospital to communicate to Grooteskier, it needs an information system. And sometime I'll make an announcement where actually we are not only in South Africa, the province, but in the whole world, to have a system that can talk to another across local governments, even in every part of the health program. So for that part of it, in terms of health system, it's something that needs to be done. So we've done a lot of innovative approach, testing all of those. But lastly, again, as I indicated, half of the adjustments goes to HIV/AIDS. And I'm listening that this cannot be accepted. This budget is being, there's an objection. So am I right when I'm hearing that someone says that cannot accept this adjustment?
Order, please. Minister, would you take your seat? Honourable Danke, if I may address you. It is the Honourable Minister or Honourable Norma French. We do not, that's not the way we do it. Thank you. You may proceed, Minister.
I'm not sure whether I heard correctly that someone says that, no, this money cannot be given for ARVs. No, this money cannot be adjusted to be provided for the young girls and women because it's half of it. What I'm hearing is that someone is washing their hands. When we say for today, when we slogan that says that it is in our hands, they take some action. I hear someone says that, no, it cannot happen. Someone is saying that youth is not important because when we talk about the HIV/AIDS, we talk about the country's economy because the youth are the future for our economy. For unhealthy youth, it means we will not have any healthy economy. So I'm getting disturbed when this is being objected, when half of this adjustment goes to the HIV/AIDS. Thank you.
I thank you.